So today we're going to be talking about spider veins, right?
Mm-hmm.
Okay.
Yeah. Which is a very common problem. Lori has a couple that will respond very well to the procedure that we're going to do. We're going to do some sclerotherapy for her today. The product that we're using is called Sclera. What it does is it causes an inflammation in the vessels. And the reason that you have spider veins is because they're not working properly anyhow. So the blood kind of settles in there. So you see the blues, the purples, sometimes even the reds on the smaller ones. What this does is it causes an inflammation in the vessels, and then it kind of closes down on itself so that those vessels go away.
All right. I was really shocked to see how many people responded. I did a Facebook question on my Facebook page saying, you know, we're looking for people to come in and have this procedure done. And a lot of people have these leg veins. Mm-hmm. What specifically are you looking for this procedure? Who is a good candidate for this?
Patients who are a good candidate for this, these are for your spider veins. So these are for your little tiny blue, red, purple veins. This isn't for your varicosities, like the big, the ones that almost look like worms.
Yeah, the juicy ones.
Yes, exactly. This isn't for the big varicosities. These are for your little veins. So if you can push on them and they go away, that's kind of a good sign that they'll respond. If it's anything like bigger, it's not going to respond just because they're so large. This is for your little tiny veins.
All right. Do you have any questions before we begin?
No, I don't think so. I'm ready.
You're ready? I have a ton of questions. I'm not even getting this done. I guess that's my job though, right? All right. So we're going to turn Lori over and we're going to talk about the procedure.
Okay.
All right. Well, now the patient is in place and we're set to begin this procedure, which is relatively quick.
Mm-hmm. Yeah. So what I'll do is after you get the patient in position, I'll clean the skin off with an alcohol pad just in the area that I'm going to be working. So she has a pretty good size vessel here on the back of her leg. So I'm just going to clean this off with an alcohol pad before I get started. Okay. And then what we'll do is we'll go ahead and get started with injections. Now, unfortunately for her, the back of the knee is a little bit more sensitive than other areas. Okay. It's a little bit tender, but honestly, whenever you have the injections done, as far as discomfort, you might feel a little tiny pinch when the needle goes in. And sometimes people say that the solution burns a little bit. Okay. But most people don't even notice it. Okay.
Now, will these disappear in a couple days for good, or will you need?
It takes a little while.
Okay.
Yeah. So initially, when we do this injection, if you can try and get a close up of this, you'll see that it'll kind of blanch itself out. Okay. So
are you ready?
Go ahead and do this pinch. Okay. All right. So you're gonna feel a little tiny pinch here. Let me just make sure I'm in the.
You okay?
Yep.
All right. And if you can see that, how it kind of just goes along the vessel itself, okay?
Yeah.
So that took care of a good portion down here. I'm just gonna grab a little.
That's neat.
Okay, and then so you can see it even goes up into here a little bit. So what I'm gonna do is I'm gonna go up here now. So a little pinch, and then you can see how it kind of spreads out in that portion.
So what exactly is that doing?
So
Are you okay?
look, now if you watch, it kind of travels up.
Right.
You can see that go up even further. So what I'm going to do is I'm going to go over here to this side because we haven't seen anything over here yet. There we go.
That is so neat.
All right. So you do get a little, you can see that little bump there at the injection site. That'll go away. They're like little bug bites after the fact. All right, we're going to go to the top here again. So that one went into a deeper one, so we didn't notice as big of an effect, but you did see a little bit of a difference there.
Now, will she have to, what does she do after?
As far as
she gets
downtime and recovery, what I'm going to do today is I'll put a little wrap on her leg. I would prefer that she keep it on for about 24 hours, okay? And then after that, she can take it off, she can shower, and then compression hose for at least, it depends, 7 to 10 days afterwards. I usually tell people anything below the knee, so a knee-high compression hose of any type, 7 to 10 days afterwards. As far as exercise, they can do whatever they want. They can be out in the sun. There's no restrictions.
All right.
Okay. And like I said, as far as discomfort, you feel the little pinches when you're having it. Afterwards, nothing. Now, afterwards, so I don't know if you can see this with the camera, but you can see that the vessel kind of almost gets a little bit of swelling too. That's completely normal, and that's what's supposed to happen because it's causing irritation inside of
Got
there.
ya.